Hi, I'm Lavinia Butler, and welcome to Luvricand Company. Today we have a very special guest, Dr. John Arredondo. Dr. Arredondo is president of the Board Medical Society here in Nashville locally, and he's also the president-elect of the Volunteer State Medical Association, statewide representing the whole state of Tennessee in medical profession. Welcome, Dr. Arredondo.
Thank you.
Glad to have you on Luvricand Company.
It's my pleasure to be here.
But, you know, you can talk about so many wide varieties of subjects, and so we're not going to cover all of those today, but at least we don't have time to cover all of those. But it is such a pleasure to have you on Luvricand Company because I've watched you and followed your career really for the past few decades here in Nashville. And I didn't say years, I said decades. and it's been very active person you are. But let's talk more specifically today about disparities in healthcare. And first, let's tell the audience what are disparities in healthcare, and then we'll talk about a few specific areas.
Well, simply put, when you look at a standard and one group doesn't come to that standard or meet that standard, that's a disparity. So if everyone should be able to go to their physician 5 times a year, and some people get to go only 3 times a year, that's a disparity of 2 visits. Or if someone is supposed to get the 6 immunizations in the first 2 years of life and they only get 3, that's a disparity. So, and then we can look at it from the point of view of status. If 1,000 people in one group and 1,000 people in another group, and in the first group, 100 of the 1,000 people, 10% have high blood pressure. And in the second group, 200 of the 1,000, that is 20%, have high blood pressure. Well, there's a health disparity there. That second group has twice as much hypertension as they should have. So in a sense, disparity is a kind of a new way of looking at the gap between what should be and what is.
Well, why do you think, what are some of the causes why we have such a gap whereas where one group might go to the doctor 2 times a year or can only go 2, where somebody might go 5? Why are there those disparities?
Well, there are lots of reasons. You know, health is the final common pathway, so to speak, of all the social forces in society. So when the social conditions in society deteriorate, then health gets worse. When the social conditions are better, then health is better. So if I look at your city or your county or your state and education gets better, then I know that health is going to be better. Or if I look at your community and I see that there are more jobs for everyone, or there's a higher level of wealth, then I know that there's a better level of health. So when I look at any of the social forces in society, the better they are, the better is health. Now that's the overall picture, and that's the ultimate answer to having the same health for everybody.
Okay.
But confining it more to the disease care industry, the healthcare industry, the disparities relate to the causes, the determinants of health, but also to some of the services that we get. So we look at the causes, that's behavior, that's environment, that's heredity, and then some of the causes are determined by the kind of medical care you get. And when we look at that, we see that some people get more medical care than others, and the ones that get less care, generally speaking, have worse health. That's generally speaking. Now, medical care is just a small portion of the determinants. The environment is a much more important determinant of health. So the people who live in a bad environment, air pollution, water pollution, soil pollution, noise pollution, have worse health status than those who live in cleaner air or have cleaner soil or cleaner water. So that's an important matter. And then behavior is pretty important. The people who have a better education and know that they should, I heard you talking earlier, eat their green leafy vegetables, okay? Yes. Now, they will have a better health than the people who don't know the importance of green leafy vegetables, as an example.
Okay.
So behavior turns out to be important. The people who never quite figured out that there are basically just a couple of ways that you get HIV, and none of them have anything to do with shaking hands or saying hello to somebody. They have to do with sex and with drug use. Well, if you don't do one of those, you decrease your chance. If you do the other and you do it safely, then you decrease your chance of getting HIV, just to mention things about behavior. It's difficult to get lung cancer unless you smoke. Some people will get lung cancer, very few. But of the people who smoke, very many of them will get lung cancer. So behavior turns out to be important. And then heredity is important as we work with it. We're putting lots of tax dollars, you know, in this new genome project. And we figured out the human genome, and we figured out the DNA from mice and bacteria and birds and things. And as we understand this more, we will understand what things do we inherit that maybe 30 years from now will cause us to have disease, or what things do we inherit, which if we do certain things and not certain other things, it will increase our chances for having disease. So when we look at all those things, all we need is a disparity in any one of them. In medical care, if I get less than you do, you'll have better health than I. If in behavior, if I don't have enough money or enough education or enough understanding, and understanding is more important than the first two, to do certain things for myself. If I don't know to exercise or eat right or get plenty sleep or wear my seat belts, then you'll have better health than I will, because I will suffer some of those consequences. If I can't or don't know better to live in a nice, unpolluted environment where the water is great and the soil is okay, there's no noise, there are no guns in the neighborhood, then I'll have a worse health status than you if you know how to do all those things. So there is environment, behavior, medical care, and heredity. And a difference in any one of those will cause a disparity in health.
Well, let's break it down a little bit. So if the environment, well, statistically speaking, I guess, would you say it's more environments or neighborhoods of people of color throughout Tennessee that might have mainly African Americans, Hispanics, or people of color that have more of disparity in health care than others?
When I looked at the statistics for Tennessee, in fact, I did not bring them with me except maybe for infant mortality, but I have looked at the statistics for cardiovascular disease, for HIV, for asthma, for infant mortality, and several other things. I've looked at a number of them. They are now available. And when I looked in the communities that had the worst health status, the majority of the time, those communities were associated with African Americans. Now, not all African Americans live in those zip codes or those census tracts where those disparities existed. But if I were to look in 100 census tracts that had heart disease at a higher rate than the general Tennessee numbers, and then I looked at another 100 census tracts that had heart disease that was at a lower rate than the average for Tennessee. Of that first 100, the majority of them will be African American. Of the second 100 with the low numbers, the majority of them would be white. And that's, and depending upon which disease I'm looking at, that majority could be 75, 80% of that 100 census tracts with the high numbers might be African American, or now that we have a few more Hispanics in Tennessee in certain areas of the state, they occupy some of those numbers. Whereas if I looked at the 100 that had the better statistics, and for certain conditions, 80 of the 100 might be white, even 90 of the 100. So there's that kind of disparity. Well, and yes, and we can pinpoint it by neighborhood and by census tract.
Okay, so we do know those areas throughout
Yes.
this entire state of Tennessee now, and in working. What disease or illness would be the highest number of illnesses in African Americans in the state?
Well, you know, the number one killer is violence. That's for everybody, white and black.
Okay.
The number one killer, that is up through age 45.
Okay.
Now, for the whole lifespan, that's heart disease. And then right after that is cancer, and then stroke, and then various forms of violence, and then on down, and then HIV and lung disease, like that, liver disease. Certain infections, come in that top 10. But if we looked at just the number one cause up through age 45, that's violence for everyone. Up through about age 35, violence is not only number one, but it's greater than all the others put together.
Wow.
Violence is homicide. Somebody really wants to do you in. And then what we call accidents, which aren't always accidents. Sometimes you can predict that someone is going to have what we call an accident because of the way they behave or the way they act, that sort
Their
of
lifestyle.
thing. Yeah. So sometimes it really is accidental, but often it's just a bad thing waiting to happen. And you know it's going to happen because of their behavior, their environment. And then we have the smallest number, which would be suicides, when you're killing yourself. So those three forms of violence, when you add them all together, puts violence number one right on up through age 45. And for African Americans, it goes even a little bit beyond age 45, on up around 50. For African American males, the disparity is even greater because African American males have a greater homicide rate than anyone in this country and a greater homicide rate than virtually any country in the world. Just homicides among African American males. So yes, we can pinpoint that, and violence is number one, and that relates a lot to behavior. Now there are some environmental things. If you go in a neighborhood where there are a lot of guns, you might get hurt by a gun. Whereas if you never go in a neighborhood where there are a lot of guns, then there's a good chance you would never get hurt by a gun. If you carry a gun, you're more likely to get hurt by a gun than if you don't carry a gun. People change their behavior when they have a gun in their possession, and they exhibit the kind of behavior that causes other people to respond to them with a weapon, as opposed to the person who doesn't have a gun doesn't always behave that way, doesn't always go in that area, and is less likely. Just one example. People who drink are more apt to have violence happen to them, whether it's someone trying to hurt them, whether they're trying to hurt themselves, or whether they have more accidents. And all of those are true for people who drink. So there's some kind of connectedness there.
Now, you mentioned cancer as the number two within this state killer. The causes of cancer, I've heard people, young people, 30, so it doesn't matter about the age. People in their 30s, 40s, you don't have to be a senior citizen and older. Cancer can come at teenagers.
That's true. And
so people wonder, well, because I hear people say, wow, he was so young. but so, it's the education then really of the causes, or how do you get cancer, or what are some of the causes of cancer in the body?
Well, there are, of course, a lot of the cancers that occur in young people, leukemias, kidney cancers, eye cancers, like that. Even though they're more than we ever would imagine, they're still relatively small numbers. And sometimes we've made connections between environmental things, where their mother lived prior to the child's birth, or what the mother and the father did prior to the child's conception. There have been some connections there. But the overwhelming proportion of cancers, of course, occur in the adults, and the older you get, the more likely, the more susceptible you are, the more likely you are to have cancer. And after violence and heart disease, and if you put stroke with heart disease, then cancer is right there. But while cancer is number 3 overall and number 2 under the age of 65, let me put that the other way around. It's number 3 under the age of 65, and it's number 2 overall. Cancer is the most feared of all the diseases. I mean, people fear cancer far more than they fear AIDS or heart disease or violence or all these other diseases. So cancer is really, and virtually every family is touched by cancer. Either a member of the family or your neighbor or your friend or somebody who works with you. So everybody kind of knows cancer.
My father died of pancreatic cancer.
I was sorry to hear that when I heard it, because I had known him, during my first tour of duty here in Nashville more than a decade ago, and respect to the work he did with the NAA and in the community.
And that's my father-in-law.
Oh, I'm sorry. I'm thinking.
But that's-
I'm thinking your father-in-law in Murfreesboro.
Well, you
But
knew.
I did
you knew
hear
all
about
of
your.
them.
But I knew. Well, see, I knew about your. I knew your mom.
Yes.
And that was.
But
I
my
knew
mom
your
is-
dad secondarily. You're
Yeah.
quite right. I'm sorry.
But that's okay.
I heard that secondhand. The cancer, and pancreatic, by the way, is one of those that we haven't figured out a direct cause. There are some associations, but not a direct cause like cigarettes and lung cancer, or like no fiber and grilled burgers on the grill
Lot
and
of
colon
high-fat
cancer,
food.
and high-fat foods and grilling that's not to say that grilled food is not good. Grilled foods are better than fried foods. But if you grill on the grill and burn up the grease
And all of that black
yes,
that people call good, that good blackened food.
Wait, precisely.
And they eating that and they think, wow, this is good eating. That's
Cancer of the
I
colon.
don't want any black on my food.
cancer of the colon. You think about cancer of the colon when you think about all of the burned grease and fat that gets accumulated on your food. Yeah, that's
That is
the
such
part
a
of
bad
grilling.
misconception, isn't it?
Yeah.
And I hear people say it all the time when they put hot dogs on the grill and they turn and they black and all that black stuff is on them. That's when they good. And I'm like, throw that away.
That's right. Yeah, if the grease is burning and it gets on the food, the grease brings with it the cancer-causing chemicals. It's great to grill where the grease does not flare up onto it and you're just getting the heat. You know, and rotisserie type stuff, and which is not over a grill, but you know, on the inside of an electrical thing. It's clearly, you know, great to take the fat off of food and bake it, grill it like that. But when you have it right there with those charcoals, and every time the spot of grease falls on the charcoals, it flames
Right.
up, brings all those carcinogens and all those chemicals that can cause colon cancer and other
Wow,
things.
wow.
Yeah. Now, we know more about ways to prevent colon cancer than we know what causes it, and we know that if you eat plenty of fiber, that's help. We think that some of the antioxidant vitamins help too, like A and E, for instance.
Beta-carotene.
Selenium and zinc.
Is that one?
Beta-carotene is the best way to get vitamin A.
Oh,
And that
okay.
way you can
Oh,
take
okay.
quite a bit of it, whereas vitamin A, you can only take so much of it, and then it has a toxic effect. So, yeah, always eat your vitamin A as beta-carotene.
Beta-carotene.
Yeah. So when you look on that little vitamin nutrition label, make sure that when it says vitamin A, it doesn't say 100% is vitamin A. You want to get 100% of it as beta-carotene if you can.
Okay.
And
And you can
yeah.
get beta-carotene. See, now I've been
That's
seeing
right.
it in carrots.
And carrots and
yellow
tomatoes
vegetables.
and squash,
Okay.
all the yellow and red vegetables
Okay.
have, and even some of the fruits, but yellow and red vegetables have a lot of beta-carotene, and that's great. That's a nice antioxidant. So antioxidants seem to help in decreasing colon cancer. Fiber definitely helps. The more fiber you have, whether it's in bran, in your cereal, or whether it's more vegetables, or whether it's one of these nice absorbable fiber
bars and stuff.
yeah, fiber
Little-
pills, tablets,
Oh, okay.
mixes, stuff like that. They have them now that are real nice fiber. And then there are various fruits that have more fiber in them. Some of the fleshy fruits tend to have more fiber than others. So all those are good ways. And it turns out that colon cancer is a big deal. When you start thinking of the 4 cancers, you think of lung cancer. Okay, right at the top. I'm speaking of cancers that kill. Okay, you think of lung cancer. That's for men and for women.
Right.
And then you think of the cancers that are related to the gender. So breast cancer in women, prostate cancer in men. And those 2 are great to think of. So that's 3 cancers. That's lung, breast, and prostate. Well, the 4th one is colon cancer. And colon cancer is right up there after lung cancer. So colon cancer, again, which is not related to gender, everybody has a colon.
Right.
And it's like everyone has a lung. Those 2 cancers are 2 cancers that we can really work on. And in the matter of colon cancer, fiber is very important. In the matter of lung cancer, of course, stay away from cigarettes and watch out for polluted air. That's the big deal there. Breast cancer, we don't have any good notions yet. There's some evidence to show that excess fatty food intake might be a problem. But we know that the genetic things are important in about 10% of people. So we work on that. And what we try to do is to tell people to get their mammogram on a regular basis. And over the last 20 years, we've been talking about self-breast exam, although there's a little controversy about that now. But until the data says something different, I still tell my patients to check themselves on a regular basis, show them how to do that, and to get a mammogram on a regular basis after they get to be a certain age. So those are the lung, colon, breast, and prostate. Those are the big four in terms of cancer. And lung and colon, there are a lot of preventive things that we can do. Breast and prostate, we try to check people on a regular basis so that we catch it early and we can do something about it.
Now, colon cancer can be cured?
Yes, ma'am.
If caught early?
Yes, ma'am.
Underline if, right?
When? We are catching it earlier faster because there's one prevention that I didn't mention, one of the very most important ones. And it's kind of like secondary prevention. And we tell everybody that every year you should get your stool checked for blood. There's a little test. And it can be done in the doctor's office or it can be collected at home and sent off for checking. There are even some tests now that are coming out where you can actually check it at home. And then every so often, after you're about 40 or 50, depending, you should get what we call a colonoscopy. That's where the doctor takes a little flexible tube and stick it up your rectum and up into your colon so they can look in there. We look to see whether there are any polyps or whether there's anything that looks like cancer and even looks like early cancer. And if it is, we take a piece of it, we send it off to the lab to see what it is, and if it's early cancer, we know precisely what to do about it. Sometimes it means taking a part of the colon out, sometimes it means taking the whole colon out, sometimes it just means taking that little section where that little thing is. And sometimes, if it's very, very early, it just means taking out the little polyp. And you don't take out any of the colon, you take out that little polyp, and you check it next year. Well, you check it in 6 months. If it's okay, you check it next year. If it's okay, a couple of years, and then you get back to your every 2 years like that. But normally, you would check the blood every year, and you check the colonoscopy every 5 years, unless they find something.
Excuse me, we were having a little difficulty there, but we're back on track. Well, you mentioned a minute ago about you could take the whole colon out. Can a person live without their colon?
Absolutely. We have about 23, 24, depending upon how tall you are, feet of intestine. And the last 5 feet are the large intestine. They have a special job to do, and they make things come out just about right, no pun intended. But if you don't have that last 5 feet, you can do very well. Oh, absolutely. Sure.
Well, now that's interesting information too.
Yeah.
I didn't. So nutrition plays a big part. In really all of the big three.
Heart disease, cancer, stroke, all of those.
It's what we put in our body.
Yes.
And eat on a daily basis. All of the good misconceptions of filling things full of butter and a lot of good saturated fat on that, and baked potatoes full of butter and breads full of butter and everything, and fried, good old fried chicken. And well, people always tell me that eating the skin, I have to know how many people say I pull the skin off.
Great,
and I only eat breast of chicken, and I pull the skin off and eat just the white meat. They said, "Ooh, you throwing away the best part," but I know better.
Well, it turns out that if you take off the skin before you prepare the chicken, all that nice flavor that they put in the skin where the fat is, you can put in the actual chicken. And as the people who give us the turkeys for Thanksgiving and for Christmas and for other holidays have taught us, you can take a little thing and stick it in, a little needle type thing, and inject it into the breast and just put your flavor throughout, you know. I've seen people do that, and you get the flavor all the way inside the chicken or the turkey. Yeah, I tell people who have to have the fried chicken just to hang out with their friends, I said, when you get that fried chicken, just be very careful and take the fried skin off. And if the other person wants it, just be nice to them. But then eat the chicken without the skin, because 50% or more of the fat is in the skin. Depending upon how they fried it, it might be 65 or 70% of the fat in a chicken leg or a short thigh or drumstick is in the fat in the skin.
So, like we said, nutrition, education is everything.
Yes.
In educating the Tennesseans about proper nutrition, and those who might have the chronic diseases, about how to take your medicine, how to take care of yourself and to try to heal, and then work on proper nutrition to even preventive measures to nutrition before it's something you get to that point.
That's right. We should have nutrition education in the schools. We've taken physical education pretty much out of the schools. Physical education is very important for heart disease and stroke. It's important for certain cancers. It's important in terms of decreasing accidents, physical education. Nutrition education is important for heart disease, cancer, stroke, for certain other issues. So those two should be in the schools. Every congregation should have education around nutrition, around exercise. And when I say exercise, I don't mean jogging, pumping iron. I mean walking, dancing, swimming, things that you can do. Walking, everybody can do. Even if you have to walk in your wheelchair, you can walk. If you have to walk with a cane, you can walk. And over 90% of us can walk with regular 2 legs. So everybody can walk. And that's what I mean when I say exercise. If everybody walked an hour a day, in 20 years we would have decreased the incidence of heart attack and heart disease in this country by 50%.
Wow.
Just by walking an hour a day. Would also decrease diabetes, would also decrease stroke, would also decrease violence. Because people walking together, there would be plenty of people out walking. And the bad guys wouldn't be able to get the little old lady by herself and knock her in the head, or the child by himself, or the teenager by himself and beat him up. There would be other people out there walking.
That's true. Well, Dr. Avendano, this has been a very informative session today. I'll call it a session. And thank you for appearing on Luvricand Company. This has been wonderful information.
It's my pleasure.
And for the listening audience. And thank you for watching. We're on every Wednesday at 10 p.m., every Thursday at 4 p.m., and every Saturday morning at 9:30 a.m. Thank you again. See you.